So the heart is another organ that becomes damaged. Coronary artery disease can result from long-term sustained hypertension that damages blood vessels. Blood vessels exposed to high blood pressures become thickened, hardened, making them less flexible. There are also changes that can occur in the heart muscle. Left ventricular hypertrophy is another condition that can result. And remember, the left ventricle pumps O2-rich blood out to the body. And hypertrophy means that there is an increase in the size of the organ. So in left ventricular hypertrophy, the left ventricle works harder to pump blood and begins to grow larger to keep up with the demand. And so this sustained high blood pressure increases the cardiac workload. This is due to increased pressure in the systemic circulation, especially at the level of the arterioles and capillaries. So untreated left ventricular hypertrophy may lead to congestive heart failure. And in this picture we see the normal heart, and then over on the right side we see an example of left ventricular hypertrophy where we see the muscle has grown in size. So how do we diagnose hypertension? Usually it's diagnosed by a systolic blood pressure greater than 140 and a diastolic blood pressure greater than 90. And this is measured 2 or more times on 2 different days. It's important that we also take blood pressures properly. Properly measuring blood pressure includes the patient to be in a seated position with both feet resting on the floor. The correct size of the blood pressure cuff is also important based on the size of your patient. So let's talk about some drugs. Once we've diagnosed hypertension, what can we do about it? Of course, diet and exercise are always going to be the first line in treatment. And then if we need to add medications, beta blockers are drugs that block the stimulation of the sympathetic nervous system and adrenaline and decrease the blood pressure. So these reduce nerve impulses to the heart and blood vessels. The heart beats slower and with less force and decreases the workload of the heart. The blood pressure drops. But it's important to remember to check an apical pulse prior to administration. Because if the apical pulse is less than 60, we may want to discuss it with the physician before we administer any beta blockers. Another drug to treat hypertension is known as an alpha blocker. Doxazosin is an example of an alpha blocker. These also block the sympathetic nervous system. So they block peripheral nerve impulses, dilate the arteries and veins, and decrease the blood pressure. There are also central acting drugs for hypertension. Clonidine is an example of a drug that stimulates the receptors in the brain stem. And this action results in reduced sympathetic outflow from the central nervous system, and it decreases the peripheral resistance, the renal vascular resistance, the heart rate, and the blood pressure. Thiazide diuretics are another treatment for hypertension. Hydrochlorothiazide is an example of a thiazide diuretic. They increase the excretion of sodium and water in the distal tubule of the kidney. Remember, decreasing excess fluid volume will help decrease blood pressure. There are also drugs known as angiotensin-converting enzyme inhibitors, or ACE inhibitors. An example of an ACE inhibitor is captopril. Remember, angiotensin II is a potent vasoconstrictor. So, if we can inhibit angiotensin I from converting into angiotensin II, we can help lower the blood pressure. It's also important to note that angiotensin I is converted to angiotensin II in the lungs, and that is why patients on these drugs sometimes develop a dry cough. Angiotensin II receptor blockers are another type of angiotensin blocker. Losartan is an example of an angiotensin II receptor blocker. And there are also calcium channel blockers. They block the movement of extracellular calcium into the myocardial and vascular smooth muscle cells. And this dilates the arterioles, it relaxes the smooth muscle, and it decreases the blood pressure. Examples of calcium channel blockers are nifedipine, verapamil, and diltiazem.